This is the big test, right? New York City is reopening. What are you going to be looking out for most?
Well, you're looking at hospitalizations and seeing if they go up. New York's in very good shape right now. If you look at the states where the reproduction rate's below 1, the 4 states where the reproduction rate, meaning the number of new cases for every confirmed case, is the lowest, is right now Hawaii, Connecticut, New York, and New Jersey. So New York's been able to drive it right down there to a very low number. Right now they have about less than 100 hospitalizations a day in the city. To give you a basis of comparison, the state of Arizona has probably more hospitalizations right now per day than that. One hospital system in Houston, Texas Medical Center, is averaging about 90 hospitalizations a day. So New York's driven it down to low levels. We'll need to watch that very closely and make sure it stays there.
New op-ed of yours, Wall Street Journal, on how businesses can keep their employees safe. The most important few things that companies need to seriously think about as we talk about the reopening of cities like New York?
Well, I think continuing to take good measures to try to de-densify workspaces, make sure there's proper social distancing. If people can social distance on a work site, make sure they have good protective equipment. The better the quality of the mask, the more protective it is. Studies have now shown that if you wear a high-quality mask, you're going to get better protection from it. So if a business can supply that to their workers, that's going to help. And then make sure you have good symptom questionnaires that you run on a daily basis. You're doing fever checks. You're going to catch a certain percentage of people that way, probably less than half of the workforce that's infected you'll catch with a good questionnaire and fever checks. But it's something. And then make sure testing's accessible. And that was the point of the op-ed. You need to make sure testing is at least accessible at the workplace. So when people don't pass a health questionnaire, you can refer them very quickly to a test facility so they can get properly tested.
The World Health Organization said today that it's very rare. Those were the words they used on asymptomatic spread. Is that true? Do you agree?
I think it's too early to conclude that. So the World Health Organization is basing this on basically looking at people who are infected and then tracing all their contacts. And then when they did that, when they went back and traced them, they found some people who were asymptomatic. And then when they traced those individuals, they found that most of them hadn't passed on the virus. I think it's way too early to conclude that from contact tracing alone. We know that people who are asymptomatic or pre-symptomatic, when we do nasopharyngeal swabs on those people, they're shedding in many cases as much virus as someone who's infected and symptomatic. So you could surmise from that they're going to be contagious. It might be the case that they're less contagious, but it's way too early to conclude that. We don't have definitive data on this question right now. So we need to assume that asymptomatic individuals can pass on the virus because when we swab them, we know they have virus on them, and we know that they can exude it.
It's obviously become a bit of a political hot potato, but do you think tonight, should Americans have confidence in the World Health Organization tonight?
Well, I don't know why the World Health Organization would go out with that conclusion in the absence of a real definitive study. I'm sure they've seen a lot of data from the different contact tracing that's been done by different nations, and they don't see a lot of propagation of the virus when they find asymptomatic individuals. But that's very different from going in and studying the asymptomatic cases and seeing what the natural history is of their contacts. And so I don't think you can conclude that from contact tracing alone. And we haven't seen any of that data made public yet. And so I think we need to be skeptical and cautious here until we have more definitive information. There's a lot of things we don't know about this virus, and it does seem to be transmissible by pre-symptomatic and mildly and asymptomatic individuals.
We know that cases are still going up nationally. 20,000 a day is the number of confirmed cases that we've used. You suggested that it's much higher than that, most likely. What does that say about where we are? And is there, let's say, quote unquote, an acceptable level of cases that would make you feel better? Maybe not zero. Maybe that's not realistic. But instead of 20,000, had we started earlier in this whole process, what should an acceptable number be tonight?
Well, look, we've seen countries that have largely extinguished the virus. If you look at what South Korea, New Zealand, Japan's been able to do, Singapore, Germany, Italy looks like they've extinguished it based on the data that they've made public. So it's possible to get the rates down much lower. I don't think we're going to be able to do it. I mean, New York, New Jersey, and Connecticut demonstrate that when you put in place very strict measures, you can drive the rate of transmission to a very low level. I think the fact that we have persistent virus now in a season when this really shouldn't be spreading as efficiently is probably a harbinger for the future that we're going to have persistent spread really until we get to a vaccine. And the question is, how do we deal with this? How do we deal with a second wave when the virus does start to repopulate in the fall, because it's probably going to grow in proportion as we enter the fall season? We've gotten a lot better at treating patients with COVID. We know how to keep people alive with measures that we're taking in the hospital. We're not intubating as aggressively. We're anticoagulating patients, thinning their blood because this is a vascular disease. But we do face a difficult future because we have not driven down the levels of infection, and it's only going to grow from where it ends up in August. So if we take 20,000 infections into August, September, October, we're likely to see that rise.
Do you think there's still too much complacency, not only in Washington, perhaps, but also around the country by virtue of the stories you're hearing and the pictures we're seeing?
I think there's exhaustion. I mean, the fact was we were only going to be able to keep the country locked down for a couple of months, and we weren't going to be able to continue that much longer. We had to reopen when we reopened. The economic hardship was too much. People were becoming exhausted by the measures. And I think it's going to be very hard to lock down again and go back to these strict measures. Maybe we'll do it on an isolated basis by states or by localities if there are large epidemics in the fall. But it's going to be very hard to do a coordinated shutdown of the country. So I think we're going to end up tolerating a higher level of infection heading into the fall and hope that the combination of new therapeutics we get online, more aggressive testing, and better medical care for people who do get sick is enough to bridge us to a vaccine, because I just don't see the country being willing, especially ahead of an election, to go through what we've just gone through. I think we're going to end up socially and culturally tolerating a higher level of infection, unfortunately.
You mentioned all that we still don't know. You said that, a few moments ago. Interesting study out today suggesting that people with type A blood may suffer a worse outcome in all of this. What do you know about that?
We don't really understand why. I mean, there's things about this virus that leads us to believe that it's causing platelets to become sticky. It's causing blood to clot, and it's affecting small vasculature. And so people are saying more and more this is a vascular disease in some respects. A lot of the sequelae, a lot of the symptoms and the outcomes are driven by impacts on the vascular system. So we really don't understand how it's impacting blood, but it does seem to have an impact on platelets, for example. And doctors are now using full-dose anticoagulation on patients. They're starting to use antiplatelet therapies. And so we're changing how we treat patients and improving outcomes. And so there's a lot that we've learned. So presumably, if we do have another wave of COVID in the fall and we don't overwhelm the healthcare system with it, we're going to do a better job preserving life. We've already done a good job preserving life in this country, but hopefully we'll do a better job preserving life.
We haven't heard much in the last days, if not week or so, about that mysterious illness, Dr. Gottlieb, that was impacting children in this country. What do we make of that? Has the worst passed, do you think, as it relates to that? How should we think about that as parents tonight?
It appears to have been associated with coronavirus, and it appears to have come about at a specific time period relative to when the epidemic really struck these cities. And so it could be the case that children got infected and then within a certain time frame developed these post-viral syndromes, and that has now passed because that time period has elapsed. This could have been something that developed 3-4 weeks after you became infected, and now we're really 8 weeks out from the peak of the infection, so we're less likely to see new cases. It is curious, you're right, that there hasn't been a lot of reporting on new cases, and so it seems to be something that's sequential, probably timed to when the infections came on.
Do you, and lastly, before we get to some tweets, I wanted to ask you about this concept of super spreaders, right? There seems to be this thought that 20% of all those infected are responsible for, say, 80% of all of the transmissions out there. And it seems timely as we're talking about cities like New York opening, as many as 400,000 people going back to work. The issue itself of these so-called super spreaders, are you still worried about that impact and that effect tonight?
It seems to be fairly consistent when you look at the different studies that have been done about spread. It does seem to be the case that a smaller number of people account for a lot of the spread. And that's not that particular to COVID. You see that with other viruses as well. And what's unclear is it the characteristics of how a person's interacting that's causing them to spread the virus more? Or is there something about the way different people shed the virus that causes some people to be more contagious than others? We don't fully understand that. It's probably some combination of both. But it is the case that a smaller number of people are responsible for a larger number of the infections. But there's nothing that we can do to identify those people in advance. And this isn't just particular to COVID. We see this with other viruses as well.